Good morning, everyone. Happy Friday. October already. I can't believe it. We have the annual enrollment period commencing on October 15th. So we're really excited now that we're living, I think, in a post-COVID world. Excited to get out there in the field, support our agents with this upcoming AEP. Today we have a special partner, LA Care Health Plan. For those of you that are not aware, I worked at LA Care for many, many years, where it was there for the launch of their initial Medicare Advantage D-SNP back in 2018, the sunsetting of the D-SNP, and the launch of the CalMedi Connect product. I've always struggled with the CalMedi Connect name. So I understand the products very well. Super excited about the relaunch of their HMO D-SNP for 2023. This is not LA Care's first rodeo when it comes to Medicare Advantage. I know that there's some staff that has come back to LA Care that have worked for other Medicare Advantage plans. So from a knowledge stand base, I think as agents you can feel very confident that it's a solid product. It's a solid organization that has been around for many, many years as a public organization under what's called the two-plan model in LA County for Medi-Cal. I know that when a new product enters the market for Medicare Advantage, there's hesitation on behalf of the agent of putting their lives with those plans because some of their concerns are they going to be here to stay? I can tell you with LA Care, you don't have to be concerned with that. They're an organization that are going to be here for years to come. The only way that they would be impacted is if there's any legislation changes in regards to how Medi-Cal managed care is managed, and I don't foresee that happening anytime in the near future. LA Care has done a phenomenal job of managing Medi-Cal beneficiaries in LA County and have been recognized with numerous awards around their ability to manage this population. And when you look at this new transition, these new models around the D-SNPs, who better to manage this population than LA Care that has been managing the Medi-Cal population, coordinating the Medi-Cal care for so many years, and now combining this with the Medicare benefit. I think it's a natural fit from an agent's perspective, from a consumer perspective, that we support the product. And I'm super happy to welcome Jezabel from LA Care. She is the director at LA Care responsible for the launch of this product. And welcome. Good morning.
Thank you.
Happy Friday.
Thank you. Thank you, Juan, and thank you, iPros, for having me. Thank you for being a valued partner. We're certainly very excited to enter the market with our D-SNP. I think everybody was accustomed to, us having the CalMedi Connect product, which was, in its sense, a little bit unique. It was part of the Coordinated Care Initiative. However, now it's, CalAIM. So lots of different changes coming with that. And I'm hoping that after today's presentation, you'll not only learn more about our benefits for our D-SNP, but also be a little bit more informed on how some of these changes can certainly impact, your members as well. So.
Yeah, no, we're super excited. And just to educate the agents that have logged on, LA Care is taking a different approach to how they're managing the rollout of this project. And correct me if I'm wrong, Jezabel, the role of the LA Care employee, the health plan representative, is transitioning to be more of a support role to the agents. So they're going to leverage the agents for production. Can you talk a little about that?
Yeah, definitely. So we do have, with us, Samira Menendez. She's not here today. However, she's a director of territory sales. And really how before we used to operate a team of, a field team of representatives, and they also, were responsible for selling. That role is transitioning to more of a support role. So sort of like what people usually typically call a broker, sales manager, and support role. So if you need help, connecting with providers or, at events, if you want to participate in some large scale events that we're sponsoring, by all means, we would love to be able to support your team on that. After the presentation, I can definitely send you a list of our field team and their contacts based on region and cities, so that if you need anything at all, if you have some events coming up, we can definitely help and support that and get you some support out there.
Of course, and these are one of the benefits of being affiliated, of being a partner as an agent with with iPros, I should say, because of the long-standing relationship with LA Care, the deep understanding of their internal structure, and just leveraging those relationships with the what are now those broker managers, as Jezabel mentioned, but our relationship with the LA Care management team. So there's a lot of support. They are going to be depending heavily, entirely on the agent distribution channel to bring in those enrollments. So if you haven't gotten certified with LA Care yet, big mistake. Let's get it's a very, very simple certification. You should be able to knock that out within less than 30 minutes. So if you haven't done so, I encourage you to do so. We are going to be reaching out as of today and all of next week to all our agents that haven't got around to certifying with LA Care, because it's important. Because once again, I want to reiterate that you are their distribution channel in LA County. So it's a great opportunity for you to build your book of business with LA Care. So I don't want to prolong this too long, because I know I'm excited to hear about what LA Care has to offer for this new Medicare Advantage plan. It's what they call a true D-SNP plan. So it gives a competitive advantage to LA Care and a competitive advantage to you as an iPros agent, and iPros being only one of just a handful of agencies, FMOs, that have a contract with LA Care. So I'm going to go ahead and turn it over to Jezabel, who will dive deep into the rollout, the benefits, and like always, we'll have a section at the end so we can address your questions, and questions are always welcome. It's funny, so some of these sessions that we have, no questions come in, and then we end it, and then they start
Don't be shy.
Yeah, they start trickling in. So now's the moment. We have the expert here, Jezabel, who's phenomenal, definitely knows her stuff. So now's the moment to ask questions, even if it's just around the Medi market and what's happening. She's a very valuable resource. So with that, I'll turn it over to Jezabel.
Thank you.
Thank you.
All right, let me go ahead and get started here and share my screen. Okay. So I'm going to start off with a little bit of an introduction on LA Care and the Medicare Plus. So for those who maybe don't have as much experience working with LA Care, we're actually the largest Medi-Cal plan in the county. So we have over 2.5 million members. We are the largest publicly funded health plan in the nation, to be honest. So, definitely, we do offer a lot of benefits for our members, especially our Medicare members. So they'll receive a comprehensive network of, hospitals, specialists, and whatnot. But, Medicare is not our only line of business. So we do also have, our Covered California line, which is our LA Care Covered. And then we do have a union plan for some healthcare workers. So, that is another line of business that we operate. But really, our Medi-Cal is kind of the bread and butter of our organization and how we started off. And with that, of course, comes a lot of dual eligible members. But we are mission driven, so we prioritize, quality, access, and inclusion, and we're very committed to advancing health equity. This year is actually a very monumental year for LA Care because we are celebrating 25 years now. And throughout these 25 years, we've gone through a lot. So, for those that follow us closely on social media, such as LinkedIn and whatnot, we do a lot of community-based initiatives. We sponsor, a lot of different initiatives. We opened our doors in 1997, as you can see, and we started off, with the Medi-Cal line of business. And throughout the years, we've transitioned, to be able to fully function to serve all lines of business. So in October 2013, we opened up, our first commercial plan, which is known as LA Care Covered. So if those of you are also certified to sell our LA Care Covered, thank you very much. And, it was a big year that year because I was actually working for Covered California when that happened. So I remember it was a really exciting time, but also a lot of anxiety because we didn't know how the public was going to receive such a big change in healthcare policy. And, fast forward, it's been, 9 years later and we're still here. And so, Covered California definitely has a big impact on our organization. But apart from all of this, as you could see, we have different initiatives out in the community. But I mainly want to point out that we have a lot of community resource centers that not a lot of agents are able to fully utilize when referring their members. So I want to take a little bit of time explaining that, because you may come across sometimes when your members are approaching you and maybe they need some help with their redetermination paperwork, like if they're a dual member and they get these notices from Medi-Cal. So if you come across those situations, just know that you can send them to our community resource centers, because we are going to have it fully staffed with people that are there to help your members with such, things as like, redetermination paperwork, or if they need like, health classes or, nutrition classes. We just have all sorts of things going on there. So feel free to go to our website, lacare.org, and then you can pull up a list of our community resource centers. We'll have 14 locations by the end of next year. So a few reasons why, you should enroll your members into our LA Care Medicare Plus. Okay, so the biggest reason is obviously that coordination of benefits. So we have exclusively aligned enrollment, which means we are able to operate as a true D-SNP. And the role that plays in your dual members is if they're receiving Medi-Cal services currently, then those services are not especially with LA Care, then they're able to be coordinated by the same company, which is LA Care. So where it gets a little bit tricky is if those benefits are being managed by two separate companies, one for the Medicare, one for the Medi-Cal. But in this case, that would not be impacted because we would manage everything. And then on top of managing, both Medicare and Medi-Cal, we're able to offer additional benefits like the transportation, the gym, the over-the-counter, and all of those wonderful additional, extra benefits that your members love. But also know that when they enroll into the Medicare Plus, they do have access to a patient care coordinator. So they will have access to a nurse or any other healthcare professional that will be their designated point of contact if they need to, make an appointment or arrange any other type of care. And then obviously we do have a large network of doctors, specialists, and hospitals all throughout LA County. So eligibility for a member to be able to enroll into our Medicare Plus is, number one, they have to qualify for Part A and Part B. So they must be enrolled in Part A and Part B. And then they also must have full Medi-Cal, so no share of cost. As long as they have full Medi-Cal, then they will be eligible for our plan. They must also live in Los Angeles County. So I want to be very specific on this because I know there are other instances, maybe other carriers that allow that cross-county, like if they live in one county and then their provider is in a different county. But this is not the case. So with our plan, you have to live in Los Angeles County in order to qualify. And then you must also be 21 years of age or older, to qualify. But the good thing is that a lot of those Medi-Cal aid code restrictions that applied with the CalMedi Connect are no longer going to apply with the D-SNP. So you don't have to worry about your members being turned down for having certain Medi-Cal aid codes. And then also having end-stage renal would not disqualify somebody from qualifying for the LA Care Medicare Plus. So there are a couple of ways that you can submit applications. You can do it the old school way. So paper applications, of course, are always welcome. But you can upload those applications if you don't want to mail them. You can actually upload them to a secure site, which is designated for your agency. Or you can also go to medicare.lacare.org, and that's actually our online application. So you can submit your paper application information on there and just upload it directly so that you can submit the paper app with the signed scope as well. And this is a very streamlined application. So it will be the same application that both your members are able to do themselves, or that you help the member with do online. And you will be able to upload all the information on there. And also, you will put your license number so you can receive full credit. So enrollment kits, if you haven't had a chance to place an order yet, you will be able to do so on lacareshop.com, or also you can place an order through your agency. And within that enrollment kit, you will find the scope, the highlights, summary of benefits. But very important, I want to call out the continuity of care form, because we want to make sure that if you are enrolling a member that's seen a provider specialist within the past 12 months, that you submit this form for them, because it's very possible they may need a follow-up visit, and we want to make sure that we can coordinate that care for them without having any kind of disruption. Now, a little bit about the 2023 plan overview. I won't spend too much time on this slide because, I think everyone's aware that if somebody has full Medi-Cal, they are not going to be paying a Part D premium or a maximum out of pocket. So this would not necessarily apply for a full Medi-Cal member. Some of the comprehensive benefits that we do offer. So we do have our fitness benefit, which is silver sneakers. Members are able to utilize any of the locations throughout LA County participating in silver sneakers. But also, if they don't want to go to the gym, then they can actually stream, at-home workouts or workout videos as well. And then we do have our nurse hotline that is available 24/7 to all of our members. We also have telehealth. So our telehealth benefit is actually managed by Teladoc. So members have the option to do a video chat call. So if it's to treat minor illnesses or anything like that, or to get certain prescription medications, refills, they're able to do that through the Teladoc. Now for vision, we do offer members $500 for eyeglasses or contact lenses every 2 years. And our vision benefit is managed by VSP. Worldwide emergency coverage, we do offer $10,000 in combined emergency and urgent care costs every year outside of the US. And then for our over-the-counter items, we do have a quarterly allowance of $150 with no rollover. So if a member wants to purchase in-store, they also are able to do that. They will receive a card in the mail for their OTC benefit. And then within that card will also be other additional benefits that I'll go over in just a few. But they will also receive the catalog with the locations of where they can go and purchase those items in person if they want to. Now, we also have unlimited round trips transportation available to all of our members. Now, for in-home support services, members have access for up to 60 hours per year of companionship and assistance. I do want to spend a little bit of time on this particular benefit because one of the questions I get a lot is, how is this different from the in-home support services that they currently receive from Medi-Cal? So this is separate from that. When somebody is receiving in-home support services through Medi-Cal, they have a caregiver, and that caregiver, has a certain designated number of hours of care they're able to provide monthly and get paid for it. Now, for these in-home support services, it's more like respite care. So if somebody needs help, maybe running some errands or, just a companion to sit and play games with throughout the day, we actually offer 60 hours per year of companionship, and that does not affect your regular in-home support services hours that somebody may already be receiving from the county, from Medi-Cal. Now, I also want to call out that if you are enrolling a member who is receiving in-home support services from the county, even if it's through another Medi-Cal plan, regardless of who it is, if it's through the county and they enroll with our plan, they're not going to have to change their caregiver. So as long as they are receiving those services through Medi-Cal directly in the county, then they won't have to change their caregiver. On top of that, we do have a really great caregiver training program. So if the current caregivers of those members sign up and go through our little training, it's about 20 hours, they will receive $1 more per hour paid for their in-home support services that they provide. Now for podiatry, we do cover up to 12 visits of routine foot care. So routine means there's no authorization required. If the member has a foot condition and their doctor submits a referral for that, it doesn't come out of these visits. This is just more like routine care if they're going to go get their nails trimmed or like the removal of the calluses and whatnot. Now for acupuncture, chiropractic, and therapeutic massage, it is coverage for up to 45 visits per year combined. That is managed through American Specialty Health, or ASH, as many people call it. But again, it is routine, so there's no referral or authorization required. Again, if a doctor submits a referral, because there's a back issue going on, for the member, if they submit the referral for chiropractic, then that is considered medical and not routine, and so that wouldn't come out of those 12 visits. For our meal benefit, we do offer 2 meals a day for up to 14 days for any of our members that are transitioning out of inpatient care or out of a skilled nursing facility. And then if we have any members that are at risk of falls or any other emergencies, if their doctor submits a request, they are entitled to a personal emergency response system device. We do also offer a special supplemental benefit for the chronically ill. So this is one of the benefits that I was mentioning that will also be included in their over-the-counter card that they receive. But not everyone will necessarily be eligible. So in order to qualify for this benefit, which is $30 allowance for healthy foods and utilities, and an additional $30 allowance for a gas flex card, they must have one of these conditions on the slide, and they must complete their health risk assessment and also participate in a care management program. So as long as they do that, they will have these 2 additional monthly benefits included in their over-the-counter card. So for somebody who does not qualify for this benefit, then they're only going to have their over-the-counter credit on that card. But if they qualify for this benefit, they'll have these 2 additional monthly benefits within the same card. So zero copay, obviously for all of these, services, hospital services. So make sure, I always remind agents, especially, when you're working with the dual population, if you ever hear anybody telling you that they're getting billed for anything, please let them know, that's balance billing, that's illegal, it's not allowed, so they should not be getting billed for services. We do also have a mental health benefit through Beacon Health, and that's mainly for substance abuse services or group therapy or any kind of medication management. So another thing I wanted to highlight is if you ever come across a member who wants to join, maybe they're currently fee-for-service, but they want to join the LA Care Medicare Plus, if they're receiving medical care through the county mental health hospital or providers that are with the county, and they want to join our plan, they could still continue to see those providers. Reason being is because LA Care is still managing that Medi-Cal component on top of the Medicare. So, usually with the county providers, if they have like a moderate to severe psychiatric condition, that will be managed by that Medi-Cal piece. Whereas through our Medicare and Beacon Health, anybody with mild to moderate mental health, they can still utilize that benefit through that, and also if they want to do like a telehealth visit as well, or just medication management. And then, of course, we have our wellness benefits. So anybody that has certain conditions that would benefit from these programs, we do have diabetes, asthma, heart, tobacco, and these types of programs that can definitely help any of your members. Now, this is just a short table of all of our vendors that manage our extra benefits and ancillary benefits. So for dental, our dental benefits are administered through Medi-Cal Dental, known as Smile California. So this is good for not just preventive, but also comprehensive. So if members need access to like crowns, root canals, dentures, anything like that, Medi-Cal Dental will provide up to $1,800 in covered services per year. And then if there's anything additional that's required and medically necessary, then as long as Medi-Cal Dental approves it, then they can also receive additional procedures. Now, prescription medications, this is another thing that is possibly not going to apply to all of the members, because if somebody has, full Medi-Cal, usually they have level 1 or level 2 LIS, so they pay very little to nothing in medication copays. But again, this is the standard, copay with the extra help. Now, a little bit about the LA Care Cal MediConnect Agent Book of Business. If you currently have members in Cal MediConnect, just know that they're automatically going to be crosswalked into our LA Care Medicare Plus in January. We will start sending them notices very soon, if they haven't already, regarding the transition. So just know that there's nothing you need to do on your part. Just let them know they're going to be automatically placed in the new plan. And also, you will still remain the agent of record and continue to receive your renewal payments. So again, a little bit more information here on the exclusively aligned enrollment. So the exclusively aligned enrollment, and I'm sure many of you have heard of this already with, CalAIM, it's when the same parent organization manages both the Medicare and the Medi-Cal. So only those organizations who have a contract with Medi-Cal can have exclusively aligned enrollment. So how I want, I really hope that everybody understands how this can potentially impact your members. So if you come across members who are receiving Medi-Cal services through the county, so I'm talking about in-home support services, maybe incontinence supplies, maybe MLTSS or any of those types of things, make sure that you do keep them within a plan that has the exclusively aligned enrollment. That way they can continue to receive those covered services directly, through Medi-Cal. So a few tools and resources. We do have a wonderful agent support team that's here to help you whenever you need, whether it's eligibility, benefits, commission inquiries and whatnot. You can call our agent support, or you can email them at agentsupport.lacare.org, at lacare.org, sorry. But also, if you don't want to call, you can actually submit a ticket through your broker portal. So your broker portal should be at lacare.org.force.com. Within your broker portal, you can actually view your book of business and you can submit a ticket for an inquiry. So if you have a question about something, then you could submit it there and get a response pretty quickly. And then if you want to order materials, you can go to your marketing portal, which is through the lacareshop.com. You'll be able to get flyers or promo items that you can order. And also, if you want to customize your flyers, already CMS approved flyers, then you can do so there if you want to print them out. Member self-service, if you have members calling you that they need, for example, a formulary or a directory, you don't have to order it. If they have access to online, they can actually, view it on their own as well, in addition to ordering it from our customer service. So this is just a very brief timeline. As you can see, we're already towards the end of the year, but your members, if you have any in CalMedi Connect, they should actually start receiving their 90-day notices pretty soon if they haven't already, and then they'll receive an additional 45-day notice. So, the Department of Healthcare Services will be sending these notices as will LA Care. But if you are currently certified to do CalMedi Connect enrollments, you can actually still submit CalMedi Connect enrollments until the end of November. So if you recall, CalMedi Connect was monthly enrollment. It wasn't that quarterly enrollment that's typical with the D-SNP and the dual plans. So if you submit an enrollment, say on November 30th, it will become effective December 1st. And then come January, it'll just automatically merge into our LA Care Medicare Plus. So if you are interested in still enrolling a dual member right now, instead of having to wait for a 1/1 effective, you can actually enroll them now and through our CalMedi Connect. So, of course, partnership opportunities, and I've said it before, I'll say it again, iPros has always been a great partner to LA Care. We have a lot of opportunities. So, being the biggest Medi-Cal plan in the county, has a lot of advantages. One is that we're able to convert a lot of that dual membership into our plans. Just as an example, 60% of our current CalMedi Connect book of business were actually already LA Care members through Medi-Cal. So if you think about that, that's a pretty big conversion. So we have, about 1,400 folks that age in every single month through Medi-Cal. And then we currently have over 136,000 dual eligible members that are not with our, CalMedi Connect plan or D-SNP. So the opportunity is there for conversion. We're always looking for great partners to help us convert those members. But also keep in mind that with, new changes in Medi-Cal regulations, we had a recent procurement going to effect 2024. One of the good things about LA Care is being a public funded entity, we don't have to go through that procurement process. So our Medi-Cal is always very safe, but we are expecting some additional members possibly. So with those additional Medi-Cal members will come more opportunity to convert some of our dual members. So again, we are always looking for really strong partners like iPros to help us convert that membership.
That's a great opportunity. Just want to let the agents know that LA Care operates differently like your traditional Medicare Advantage plan. As a public organization, they have a specific way how they want to not only roll out the product, but also the distribution. So I will be reaching out to all of our agents individually to tell you a little bit about how we are rolling this out with LA Care, some co-op opportunities for marketing dollars, and some lead opportunities as well. So again, we feel very excited, very privileged that we're only one of a handful of agencies that LA Care works with, not to mention that one of the top producing agencies. If you look at the iPros production humbly compared to the other agencies, we're one of the top producers. So that says that we know what we're doing. We have the relationships in LA County and the LA Care support. So more to come. I know that Jezabel tugged at my ears yesterday, and hey, look, we're looking at the certifications on the agents, and we need them to get certified. So again, we'll be reaching out to all of you here within the next 24, 48 hours to make sure that by next week you get certified. It's only going to take you a few minutes, and then we can dive deep. We can dive deep on the strategy from there. So Jezabel, excited. Thank you. Appreciate
You're
it.
welcome.
The support.
Thanks for having me. Any questions from anyone?
Have we come to the...
We do have a question, Jezabel.
Sure.
From Sam. He's asking, does LA Care website have recording capability due to the CMS requirement online application?
So internally within our plan, no, not yet. we are working on it. So we previously used to use Ascend. However, we stopped, for this year, we're no longer going to be using Ascend. We're hoping to be able to get another third-party tool. So can't say too much information. However, that will have recording capabilities. So more to come on that. But for now, just know that you can always submit and upload the paper app directly into our website.
Now, October 15th is right around the corner. Your technology that you're adopting will be in place by the 15th?
So we already have the online app.
But from a recording standpoint, it'll be up and running by the 15th?
Possibly not.
Okay.
Yeah.
So more to come on that. For those agents that are not aware, we use Connexure as one of the technologies that a Connexure offers is the recording capabilities, and we demoed that this week. We did pass that on to LA Care, so I don't know if Connexure is one of those vendors
That's who we're working very strongly to secure internally. It's being, publicly funded. There's a lot more regulations that we have to, hoop and hurdle through. So,
So Sam, great question. Very hot topic. Now that you brought it up, that's something that we'll be working diligently with LA Care before the 15th to get instructions on how that recording needs to take place. So great question. I don't see a lot of other questions coming on the board, so I guess I'll initiate some of the questions. Jezabel, from a network perspective, are we dealing with the same network we were dealing with CalMedi Connect?
Yeah, so not too many changes on the network, that I've seen. I'm not sure. I know there are a couple negotiations still going on, so I'm not, able to disclose those. However, not at the moment that I know of.
Okay, thank you for that. Now, as you know, we've been working with LA Care for CalMedi Connect from the beginning. We do have agents that have a current book of business under CalMedi Connect, and some agents that are going to be coming across CalMedi Connect members. Can our agents enroll their current book of business, or can agents enroll new beneficiaries into the LA Care D-SNP plan for a 1/1 effective and become the agent of record and get paid commissions on them, on the enrollments?
Yes, absolutely.
And that's very important. So we'll be working with all the agents that currently have CalMedi Connect members, so that you can go ahead and start locking in your in-home appointments with these members, so that you can enroll them through the paper app or online app to the LA Care HMO D-SNP plan.
Yeah, and so also you can still enroll CalMedi Connect right now. So it's all the way until the end of November. So it's another way to get a head start in, your enrollment, so you don't have to wait till the 15th. So if you have new members going into, that want to join our plan, they can enroll into CalMedi Connect now. They'll be effective, this month they would be effective 11/1. If you enroll them in November, then it's 12/1 because it's monthly. But then they would automatically transition over to the LA Care Medicare Plus in January.
Okay, and then from a commission standpoint, LA Care obviously will follow the CMS recommended commission rates.
Yes.
So just like your other traditional Medicare Advantage plans, you're going to get paid the same commission as well as the residuals. And again, we talked about at the beginning from a long-term perspective, is the product going to be around? LA Care, when they sunsetted the original D-SNP, was because at that time the pilot seemed to be a long-term play for the county, this product rollout, it's expected to be long-term.
Yes.
Okay, great. That's great, because our agents are looking for that stability, right? As they're building their book of business,
right?
Can they count on that beneficiary being on the plan for the longest period of time? Rodrigo, do we have any other questions for Jezabel?
We don't have any other questions. We still have a few more minutes, so I want to welcome everybody to send the questions through the Q&A box at the bottom of the screen. I'm not sure if you have any more questions, Juan.
Yeah, let's talk a little bit about kits. The enrollment kits have already been delivered to your FMOs. Have we received those already, Rodrigo?
We should have had an order placed already, so should have received them.
On behalf of all the iPros staff, we've been getting boxes from all the carriers.
So I have to sort through them.
Don't know, yes.
So we've been getting a ton of boxes, agents, from the different carriers. As we speak, we have the team looking at the inventory, sorting them for distribution next week. So we'll touch base with everybody in regards to getting those kits out to you. Anybody on the line that has not yet appointed with iPros for LA Care's Medicare D-SNP, reach out to us. Go to our website. We have our info at iprosteam.com. Feel free to send us a message. We'll reach out to you right away and get the process started to get you appointed right away with LA Care. It's a simple process. Even if you start by Monday of next week, you should be already ready to sell in time for October 15th.
Correct. And for those agents that are joining us today, the email, if you would like to get more information on how to get appointed with LA Care, you can email contracting@iprosteam.com, and we can send them more information, the link, all that stuff, because we also need to retrieve the credentials from the agent. So definitely email contracting@iprosteam.com.
Thank you, Rodrigo, for that correction. Once again, contracting@iprosteam.com. So I'm really surprised that we don't have a ton of questions, being that this is such an important transition. But again, I mentioned that questions start trickling in after the session.
Yeah.
Jezabel, thank you for the informative presentation. As you can see,
for having
your
me.
benefits rival any Medicare Advantage plan out there. Again, I want to reiterate that it's a true D-SNP plan. It's all about coordinating the benefits between Medicare and Medicaid. And I say this confidently that there's no other plan out there like LA Care when it comes to really understanding how that coordination of care works at all levels, right? When you look at IHSS, when you look at individuals that need special needs beneficiaries. So I encourage you guys to really look at LA Care when you're dealing with these beneficiaries. We have a fiduciary duty to put those individuals with the right plan where they're going to get the best care, and that's really what we're trying to do is find the right plan where they get the maximum out of their Medicare, and in this particular case, how to get the best and the most out of their Medicaid benefits, right? So thank you everybody once again for joining this session of iPros TV. I hope you find this informative. iPros TV is really taking off, getting a lot of compliments out in the marketplace around the information that we're putting out there for our agents, for our partners. So more sessions to come, not only general market information, but more sessions around LA Care. Maybe we can plan one midway in AAP and talk about some of those things that are happening with LA Care. Maybe even a session around your recording capabilities, whatever those are. And looking forward to the next session. Once again, thank you. Happy Friday. Happy AAP. Happy selling. I hope every single one of you have a very successful annual enrollment period and OEP. As you know, iPros is a year-round agency. But again, wish you the very best this upcoming AAP. Thank you. We'll see you next time.
Thanks, everyone.
Thank you. And everyone, as a reminder, we do have our iPros TV channel on YouTube. So you can look up iPros TV or iPros Insurance Professionals. And we are recording all these webinars so you can watch on demand, if you can share with your agent friends. So go ahead and subscribe, and so that you will be notified once we upload some content. Thank you, everyone, again for joining.
Friday. Bye-bye.